We are back live at the Turtle Hospital in the heart of the Florida Keys, and we are here with Dr. Doug Mader and Coco, our gorgeous female adult loggerhead sea turtle, and we are just following up to see how those follicles are doing. She is a reproductive female, and it is nesting season here in the Florida Keys.
So we're looking at her reproductive tract, and what these little spots are here, these are future turtle babies.
So we are looking at the future generations of sea turtles here. How do they look as far as what stage of development?
Well, they're still on the ovary. They haven't ovulated yet. So they're maturing and they're getting very close to ovulation. After ovulation, then they go into the shell gland, and then that's where they get fertilized, and then they get their shells, and then they come out and they become babies. Yeah, so she's got what we call a mature ovary, and all of these follicles, you can see by the little dark spots, they're just about ready to rupture and come out.
Wow.
So she looks good.
That is exciting.
She's got probably more than 100 in here, and they look very healthy, which is great. Okay.
So welcome back from Malaysia and Ohio. Thank you for joining us. You want to check the other side?
Sure am. So do you mind telling me how
Okay, and we have Jen and Olivia. They're doing wound care for that boat strike wound in her head. Welcome from the Dubai Turtle Rehabilitation Project. Thank you for joining us. We have Jen and Olivia flushing that head wound while Dr. Doug Mader is doing an ultrasound, and Tom helping with handling.
So again, same thing, which is what you'd expect. So these are all still on the ovary, and they're all very healthy, nice, good-looking follicles.
Nice, good-looking follicles, Dr. Doug says.
Very healthy looking. Okay. She's got a normal amount of fluid around them. No, this looks nice and normal. So get her head wound healed up, and hopefully she'll be able to deposit these eggs. Yeah, they look good.
So are we cautiously optimistic? She'll be
Absolutely.
all right.
Absolutely.
Cautiously optimistic we can get Coco out there in time that these eggs can become baby sea turtles. So that is some positive news for Coco. She has a long way to go. You can see her getting wound care with that boat strike wound to the head, and just a good opportunity to remind all of our boaters out there on the water. Just watch out for sea life. Remember, sea turtles, dolphins, and manatees, they breathe air like we do, and they have to surface to take a breath. So you want to obey the speed laws. Have a spotter on your boat. Have somebody on the front of your boat watching out for sea life. And if you do see an injured sea turtle, you can call Florida Fish and Wildlife or our 24-hour stranding hotline. And if you don't have any of those numbers, not to worry. You can radio the Coast Guard. They are great partners. We hope everybody is well and staying safe. And thank you for tuning in. We're here with Dr. Doug Mader of Marathon Veterinary Hospital. We have Jen and Olivia, rehabilitation specialist extraordinaire, and Coco, the turtle of the hour, is getting a scope of that deep head wound. Dr. Doug, can you tell us what's going on?
Okay, so we're looking at part of the crack right above the jaw, and the joint in the jaw called the TMJ is working normally. In fact, we can actually show you if you want to try and very carefully, very carefully open and close that jaw. See, there's your jaw joint. So the trauma didn't affect the joint itself, so that's excellent news. Thank you, that's perfect.
All right, great news.
Okay, so
Still
when you flush this.
cautiously optimistic
where I'm
with
going?
Coco here.
All right, so there's a little bit of infection right there. You want to snap a picture of that too? So this is where you want to get your catheter. Look up here to the upper left at about 10 o'clock. See that? Get a picture of that. So that's where you want to get your catheter. You see how far back I am? Where I am right now? Yeah. So I'm a good 2 centimeters in there. That's where you need to concentrate your flushing. Okay? Other than that, I mean, you guys are doing a great job. Because most of the rest of this, look how clean that looks. Okay? See this pink tissue on the left here and then the nice eggshell tissue above? That's all healthy and healing. So we're getting there. Okay? It's a very deep wound. Good job.
Welcome from Germany, Maryland. Thank you for joining us. New Hampshire, Pennsylvania. Thank you for joining us
Did you guys
today. We're
want-
here with Dr. Doug Mader
Do you want to get a picture of that? Just
with a close-up look of Coco's head wound.
maybe get one with this too. I don't know if it'll focus.
Coco has been sedated. She's not normally this quiet.
There you go. Okay. All right.
Welcome from Belgium and Wisconsin. Thank you for joining us.
Do you red lights, please?
Thank you for joining us from Europe and Germany. We're here with Coco, an adult
So, did you
female
want to
loggerhead
flash
sea
them while we got it on the
turtle.
table?
Yeah, we were
Okay.
gonna ask we can hook up like a bag with a pressure bag.
That works. Yeah. You want to do it in here? Or you want to do it in the other room?
Either one works.
Okay.
Did you want to ultrasound her at all or not?
Yeah, we can
Okay.
ultrasound her.
When they have a wound, do they bleed?
Saline flesh or
Yes, they do
I
bleed, but
actually
this
like
is an
using
older
blue
wound.
betadine. Now, there's pluses and minuses. It's a good antiseptic. Straight betadine is actually an anti-fibroblasticidal, which means it prevents healing, so you don't want to use straight betadine.
Thank you for
If
joining
have
us
a
from
really
Southern
infected wound,
California
like
and Virginia.
something that comes in just full of pus, you can use straight betadine for a couple, 3 days because it starts to cauterize it. But then after about 2 or 3 days, then you want to use dilute betadine. And the way we call it is weak tea. So in other words, you looked at iced tea, right? You have it in a glass, you can actually see through it. So it's just enough betadine to give it that weak tea look. And what that does, it's a good antiseptic, but it's not strong enough to damage the fibroblasts, so it allows healing.
So we are going to stay live here. They're going to flush the wound, and then we're going to do an ultrasound to check on those follicles. She is an adult female.
Sure.
There's a good chance that she came close to our
Would you
islands
like
to
me
nest.
just
It is
clean this up
sea
here, or
turtle
what would you like me to do with this?
nesting season in the Florida Keys. Welcome from Maryland and Malaysia. Thank you for joining us. From Ecuador, Colorado. Thank you for joining us today. Dr. Doug has been working with the Turtle Hospital for over 2 decades. And again, Coco is
I still
sedated.
wanna
That's
look
why
at
she's
that.
so quiet.
Okay. What do you wanna
Let's get the.
We're going to stop the live feed now and come back live in about 10 minutes with the ultrasound.